there's one part of the interview which in some places they can offer a role play scenario. So this is often something where you sat down with an actor or and there's an examiner in the room, or something like that. And this is just, again, you could be given a scenario that you have to act out, or you could be given a task, or something a bit more practical than just answering a question. So some examples could include sort of taking a medical history. So you're told to sort of sit down with an actor who's playing a patient, and you've got to take their history. Sort of, it might be a good idea to look at some sort of history taking, points, and just to have those in the back of your mind, so you're able to have some sort of structure to the scenario. You might have one such as breaking bad news, and this is looking at your sort of communication and empathy skills, showing that you're actually able to sit down and talk to someone in such a calm way, and being able to break something where you don't know how the person's going to react. They could be absolutely devastated, or they could get really frustrated and angry, if it's some sort of medical problem that's gone wrong and led to a death. So it's just knowing how to deal with that, how to deal with the sort of uncertain outcomes of, how the patient's going to react to you. It could be giving someone advice. This might be another colleague or a friend, or, and it's almost taking into account the situation that you're in, because if it's a friend, you could be a bit more colloquial, a bit more chatty, because it's completely different how you'd speak to a friend as you would to a colleague, whereas with a colleague it'd be a lot more professional, sort of. Again, it's understanding the context of the situation, and how, again, it's understanding how the other person would react, and it's just really trying to understand them and working your answer around that. So it might be helping someone to overcome a drug or alcohol addiction. So this, again, is similar to someone seeking advice. It could be a role play within a general practice consultation where you're the GP and have to give advice to that person. So it's good on things like that, maybe to have some facts in the back of your mind, sort of knowing how many deaths are related to drug and alcohol abuse per year, or maybe even something like smoking. So it's just good having those ideas in the back of your mind to be able to recall them, because being able to use facts, it sort of, again, gives you an extra angle to the answer. And again, it's also taking into consideration empathy and understanding of the patient and what they're going through, because it's also nice to have an idea of the fact that it might not just be a standard drink or drug addiction. It might just be something underlying, maybe a mental health condition, maybe something's gone wrong and that's triggered the issue. And it's just looking around it rather than having a closed mind. It's thinking outside the box when you answer things. It could be speaking to a family member. Again, this is a bit more sort of colloquial and relaxed. If you're talking down, speaking to your mum in this role play scenario, it's a lot more chilled, it's a lot more relaxed. And then there's one, and it's speaking to a mute person. This is looking at different ways of communication and showing that you've got the ability to work your way around maybe difficult scenarios, because a mute person won't be talking back. So communication will have to be a lot more sort of expressive, and you'll have to be able to understand that person without them speaking. So it's looking at other factors rather than just talking. It's other factors of communication which are really important to consider in consultations. So again, the key to role play is just don't lose your temper. If the patient starts getting angry or frustrated, don't show it back to them, because again, that just shows that you can't control your emotions, and that maybe it just shows a resilience issue with, if this was to happen in real life, that could then result in a complaint made against you. It's showing active listening, so sort of nodding along to what the person's saying, and sort of giving feedback to what they're saying, really listening to what the person's trying to tell you. So it's not just sitting there and just listening and not saying anything. It's sort of really trying to understand the situation, because again, this is a key factor as a doctor. You've got to have active listening, because if you're not actively listening to your patients, then you're not going to get the maximum that you can out of the consultation, and the likelihood is you're going to miss something. So again, really get into the role and treat it as though you're really in the scenario yourself, because at the end of the day, you might feel stupid doing it, but it's a maximum of 10 minutes, just really trying to immerse yourself in the role and just really trying to get into it. And you might seem that it's being a bit sort of forced, but at the end of the day, when you're there in a consultation in real life, then it's going to be a similar thing. You're going to have to really get into the situation. So again, adjust your approach to each scenario. So as I said, you talk to a family member or a friend completely differently as opposed to a work colleague or your boss. So it's just important to sort of understand that and be able to adapt your role, sort of the way you talk, the language you use. For example, being in a consultation, you'd reduce your jargon if speaking to a patient. If you're speaking to another medical colleague, you'd still use that medical jargon because you're on the same terms and you both understand it. So there are some key factors that are important when being in a role play, and one of them is sort of empathy. So empathy, there are a few sort of key phrases and buzzwords that you can use. So examples of empathy, again, it would be sort of breaking bad news, or maybe trying to talk to an upset friend or something along those lines. So it's sort of, again, useful to use these alongside active listening. So saying things such as, I understand this is distressing, I can see you're in pain, especially if you're talking to a patient who, they might be in chronic pain and, really debilitating for them. So it's important to show that you're picking up on these cues and you're not just presuming that, they know you're in pain. It's important to show that you know that they're in pain. And it's things such as, I'm sorry you feel that way, that must have been terrible. And sort of, again, it's just active listening skills. So saying okay, I see, I understand that, yes, of course. So again, this is just something useful. It's a useful thing to sort of pick up again if you sit down with a friend or something, or again, someone who doesn't really know you that well, and just get them to role play a scenario. Because again, they can maybe pick up on factors that they'd want you to use, or that would be better for you to use next time. And again, as mentioned earlier, so sometimes, especially with sort of role play and displaying empathy, it's good to sit down with someone that you might not know that well. So as sort of mentioned earlier, those kind of people are able to pick up on more sort of cues and might be able to prompt you a bit more on what you should and shouldn't be saying. Because often with family members, they're used to what you like and what you're saying. So again, just have someone a bit impartial and a bit different, and that could be really helpful. So some other tips for sort of empathy. It's sometimes good to have silence. Although active listening, it is good, but say if, the person on the other side of the role play is being quiet, it's sometimes good to sit there and let them think, or let them cry, and let them, just let them diffuse for a while, because sometimes, that's good, and that it's not awkward, it's good, and it's should be encouraged to some degree. Obviously not extensive silence. It should, have a happy medium. Another issue is don't touch the person. It might be tempting to sort of put your arm around them, or sort of rub their back, or but again, that can be a bit of a sort of red flag, because it's just not, it's sort of impeding their personal space, and that might be frowned upon. Another good tip, if the person starts crying, if there are tissues on the table, just little things like that you're able to think of, and hand them a tissue. It's not, again, it's not fake, it's not false, it's just trying to show yourself in the best way possible. And in real life, if someone was crying, you would give them a tissue. Just because it's an interview, it doesn't make it any different. So again, just try and be as real as possible. So there's an example here of convincing someone to stop smoking. So now we're going to do just a short role play, just demonstrating an example of a GP trying to sort of convince or encourage one of their patients to sort of stop smoking. So yeah. Hi Francis, my name is Robin. I'm the GP today. So how can I help you?
Well, I've just been feeling really stressed and just really down lately, and I've just been smoking a lot, and I'm really kind of struggling with it, because you know, it's something that's been going on for a long time, and
Yeah.
it started to kind of escalate now. So I came for just a bit of advice.
Yeah. Yeah. Okay. So you said that you've, started smoking a lot. How many cigarettes or how many packets a day do you think you're smoking on average?
Probably about 60, I'd say.
60.
On a typical day.
Okay.
So.
Right.
Yeah.
All right. So how long has this been going on for? So you said it's been going on for quite a while. Do you have a rough idea of, months, years?
Yes. I think it's probably been going on for about 7, 8 years now.
Okay.
I started off as like a teenager. It was kind of like social
Yeah.
smoking kind of thing, and now it's just been getting a lot worse. So
Yeah.
yeah.
All right. So has anything recently changed that's sort of made you increase your smoking, or you said you're a bit stressed, so
Yeah.
sort of has anything triggered that?
Yeah. Well, it's just been a bit hard recently because one of my family members passed away.
I'm sorry to hear that.
Yeah, and it's just the whole idea of being able to manage that and trying to adapt to the situation has been very difficult for me. So I think that could have potentially triggered it. But,
Have you been receiving any help for bereavement at all?
I mean, I've got like quite a few supportive friends and also a few other family members as well. Who have been supporting me through this as well.
Yeah.
So yeah, it is getting better, kind of coping with that. But then at the same time, the smoking thing is kind of making things worse. So
yeah, it's a bit of a double-edged sword, really.
Yeah.
Okay. I mean, from my end, I can sort of out some sort of bereavement counselling. If maybe you'd like to look into that, that could, it might help towards the sort of bereavement side of things, which might then help the smoking a bit. I mean, if you're sort of wanting to think about that or need to set up a referral for that, I'm more than happy to do so.
Yeah, I mean, that would be an option. Is there anything that you could do in terms of providing support to help me stop smoking specifically?
Yeah. Well, for the smoking specifically, obviously you need willpower.
Yeah.
So if you feel that you're in the right frame of mind to stop smoking, I mean, obviously you've come to me today, so you must have some, sort of determination to sort of stop. So from my end, we've got a smoking cessation nurse within practice. She's able to sort of talk to you about your habits, and we can get you sort of started on maybe some nicotine patches. So obviously you're aware of the implications of smoking. You not really?
Not really, no.
Okay, no, that's fine. So basically, the issue with smoking, it obviously it irritates, the tubes which go into your lungs and help you breathe. It can also damage the lungs themselves. So about issues like lung cancer. Does anyone in your family smoke or?
My dad smoked for quite a while. Yeah. My mum doesn't smoke.
Your mum doesn't smoke. Okay. How's your dad? Is he or? How is your dad? Is he okay?
I'm not too sure at the moment. He died quite a while ago, so yeah. I'm not sure what he died of. It could have potentially been the lung cancer that you were talking about, so, but I don't know a lot about it, yeah.
So basically lung cancer, it's sort of the most detrimental side effect from smoking. Not to scaremonger you, but it, sort of 9 out of 10 cases are caused by smoking. But I mean, it's just obviously because of the irritation given by the smoke, and it's toxic and it can cause lots of nasty problems. There's also a thing called COPD. So this is chronic obstructive pulmonary disorder. So not to flag you down with words, but this is basically where the tubes bringing the air into your lungs get irreversibly narrowed. So that means not a lot of air can come in and out, and you can get quite wheezy, quite out of breath, and you can get quite a lot of infections because of that. So there's just a lot of issues that can arise from smoking, and again, it can make you out of breath, tired. It's also quite an expensive habit, if you probably noticed. So that's probably one thing that you'll find quite quickly, you know, you'll have a bit more money here and there, and you know, maybe again, as an incentive to stop smoking, you could use that to sort of buy something nice, or you know. So there's a smoking cessation nurse, as I mentioned earlier. So she'll be able to give you start you on maybe nicotine patches, look at other alternatives. Have you tried sort of e-cigarettes at all?
I have tried them,
but not.
No, it doesn't really do it for me.
Yeah. Okay. So we'll get you an appointment with the nurse if you're happy with that. What do you think?
Right. Okay. Yeah. I'm happy with
Yeah.
that. Yeah.
So we'll sit you down with her, and she'll have a chat with you about getting either patches sorted or anything that will work for you. We'll talk about your habits. I'll be able to sort of get that referral sorted to the bereavement counsellor if that's what you're wanting. Is there anything else that I can do for you today?
No.
Any other questions that you'd like to ask?
That's all I came for.
Okay, that's
Thank you very
fine.
much.
No problem. Thanks.
Thanks.
Okay, so in that scenario, the main thing was sort of introducing yourself and sort of asking how the patient's doing, asking the patient's name and things. And again, it's important to ask about why they're here, what their recent health is. As Francis mentioned in the consultation, him being quite stressed, and then mentioning the smoking. So it's good to pick up on associations like that, because the person, again, that yes, they might smoke, but the stress might have increased their smoking habits. The stress might have caused the smoking in the first place. So it's just good to look at other alternatives as to what might have caused the issue. So again, it's just talking that through with the patient, and then again, I was trying my best to display active listening skills. So sort of nodding, really trying to engage with Francis on what he was saying, and being able to show that I was listening and understanding. So again, using sort of like open questions. So for example, I was saying, oh, so you said you're stressed. So again, tell me a bit more about that. So it's just good to have that idea to keep it open and not to direct questions with a yes or no answer, because that keeps the consultation quite rigid and quite, you know, you want the consultation to be open and patients to feel comfortable discussing with you. So again, it's also important to check that the patient understands what you're saying to them. So in that consultation, I maybe tried to jump in a bit too quickly and then decide to check whether the patient understood. But I think what you're best doing is approaching it, asking the patient if they understand any, you know, medical jargon, do they understand the risks and implications, and then if not, then go on to discuss that with them, because it just, again, maximises their understanding and removes sort of barriers that are put in the way, which can prevent a patient from really understanding information and taking it home. And again, as I mentioned before, it's picking up on other sort of problems that arise in the consultation. So again, the primary issue was the smoking, and that was addressed. But again, the stress from bereavement, it's nice to be able to pick up on that and to be able to put something in place for that as other alternatives to try and reduce the main issue, which is the smoking. And yeah, do you have any?
No, I think that's pretty well explained.
Yeah. And again, just providing information and rounding the consultation off nicely, asking if the patient has any questions, sort of any concerns or any other problems, which always makes for a good consultation. So relating back to that scenario before, it's always really important to have in the back of your mind sort of consultation skills and things which really make a consultation and taking history stand out. So as I said, it's not just what you say, it's also your communication skills and how you come across within that scenario. So sort of the prime position for taking a consultation would probably be where you're both sat down but not facing each other eye to eye, because that can become a bit confrontational. So it's often quite good to have the chairs at an angle, sort of sitting by the patient, you know, having it open but, you know, not directly facing each other, because again, you don't want it to be confrontational. And again, you want enough distance between you both for it not to be too suffocating, but not too distant and not too apart. So again, as I said earlier, having open questions with the patient. So there's a thing, and it's expressing ideas, concerns and expectations. So this is a quite good structure to have within consultation. So sort of ideas that the patient might have, so why they're there, you know, what they want sorting, sort of concerns that the patient has, why have they come today, you know, why are they worried, and expectations, sort of what is it that they want out of the consultation, and what can you give to them to sort of benefit things. So those are some key points which are really good at being able to maximise the consultation and get as much as you can out of it. So again, at the end, it's always really nice to round it off, just to summarise what you've talked about. Like I said earlier, I sort of summarise saying, okay, we're going to get you sent to the smoking cessation nurse to try and reduce your smoking habits, and referral to bereavement counselling. So again, addressing the two main issues that were presented at the start of the consultation.